And we continue our back-to-school coverage now, required by all Rhode Island schools. Our list of vaccines each child must have to attend class.
Even though Rhode Island has some of the highest vaccination rates in the country, there's a concerning trend emerging nationwide and here in the Ocean State. 12 News anchor Shannon Heggie joins us to explain.
In my latest episode of 12 Health, I sat down with a local pediatrician and a doctor from the State Department of Health, both of them concerned over the rising theme of medical freedom, championed by current Health and Human Services Director Robert F. Kennedy Jr. They say it's led to a rise in the number of parents requesting vaccine exemptions for their children. Dr. Beth Lang, a pediatrician in East Providence, believes a lot of it comes down to the fact that vaccines have worked so well for so long that most people alive today haven't seen a case of polio, meningitis, or measles and forget how important these vaccines are. Our country has seen a spike in measles cases recently as more patients and parents opt out of the MMR vaccine, a decision both Dr. Lang and Dr. Carla Martin with the Rhode Island Department of Health say is a result of spreading misinformation online.
I think one of the things we're hearing these days is parents keep talking about parent choice. It's my choice whether I vaccinate a child or not. And it is always a parent's choice to make the best decisions for their children, just like they have them wear bike helmets, they have them wear car seats. We wouldn't even think about putting a child in a car without a car seat. The thing about the measles vaccine, the measles, mumps, and rubella, is we're not only vaccinating children to protect the children, we're also protecting the community. All vaccines are protecting people against diseases that are out there. Germs, bacteria, and viruses, their job is to make us sick. And so when all of us are protected, the bacteria and viruses can't do their job. Measles, in particular, requires that 95% of the community is protected and vaccinated against measles. So if enough parents decide to have their parent choice and choose not to vaccinate their child against measles, it challenges the rest of us in the community because measles comes in, and even people who are fully protected against measles with their 2 vaccines may be at risk. We're also protecting people who can't get the vaccine. We have many children in this state who are undergoing chemotherapy for cancer, who are taking medications that suppress their immune systems because of skin conditions, gastroenterology conditions. We have many parents who also are immunocompromised. They've had transplants. When we get vaccinated, we're protecting our community and we're protecting all those other people too.
A concept otherwise known as herd immunity. Dr. Martin told me even though Rhode Island has one of the highest vaccination rates in the country, she's concerned that from 2024 to 2025, the number of religious exemptions from vaccines for kids entering kindergarten went up from 1 to 1.7%. She says they saw the same thing with students entering 7th grade and some entering 12th grade. Coming up tonight at 5 on 12 News, we talk about the differing recommendations at the federal level and from the Academy of Pediatrics about COVID vaccines. I'm Shannon Heggie, 12 News.